Hi guys. I'm taking a quick break from my very busy schedule, and I'm like, yo, it's winter. Everyone is sick, everyone has flu, people are calling me, they're scared of this new COVID variant, and they're asking, where do we sit, where do we stand? They heard Kutakoma COVID vaccine in South Africa from the news. People are informed. Well, what I appreciate more than anything about this whole thing is the health literacy. Since educated emzantsi ngoku, everyone knows about flu, everyone knows about COVID, everyone knows about the variant. It's just amazing. I love it for us. Health literacy all the way. When people are literate, they are aware, and if they are aware, they even know how to protect themselves, and that's what you need. You don't want people that are dependent on medicine. You don't want people that are dependent on the system, or that are dependent on the state or somebody else to protect them. You want people to take responsibility over their lives and protect themselves. And I love it for us when we are this educated. Anyway, answering you, about the variant is not yet picked up in South Africa, right? But you remember, COVID yaqala ancestral strain, the first strain, esakhosa the pandemic. And then masese kuba ngcono kuzoba another wave because of another strain. Because evolution, viruses, they evolve over time. That's why the science evolve over time to catch up. I'm sure right? So because viruses life cycle yawo evolve each time and again. I did say the way they are evolving, we always compare it with iphone yakho now connected to Wi-Fi, izothi upgrade, automatic upgrade, besiyazi upgrade, right? And then yazi upgrade, and then your camera is better, your apps are better, everything is improved. You have on nayo injalo yazi upgrade all the time, constantly, and each time is upgrader, it infects us better. I'm just saying iba better. It upgrades itself to infect us better, or to live better itself. So it improves itself. So it being more improved means it infects us better, of which that's not what we want. But the life cycle, there's nothing we can do about it to them, but we can definitely do something about ourselves to protect ourselves. So we are within a flu season. A flu season, it's normally winter months. This is because in the winter, we are all in closed doors. We come closer to each other. Even at work, we want to close doors. Everywhere, we just want to close because it's so cold. Due to the cold weather, we want to close our doors. So when we're closing our doors, if anyone coughs or anyone is breathing their viruses, everyone gets to be infected. Then everybody gets sick at the same time. So that's why I'm flu holidays or flu months, most people get to need everyone gets flu. Most people get flu, and then it means if we are all exposed to flu, those that are vulnerable or are at risk of severe disease, then it means they are going to be, as we are all exposed to this virus, they are all going to now come to the hospital or to any healthcare facility to seek medical attention. While those that have stronger immune system are able to fight off the infection themselves. You know that flu are self-limiting, right? If you know COVID lab, majority of the people don't get very sick, but we still have minority of people that we are really worried about. I always go back to my statistics. So I estimate at about 11,000 people in South Africa annually, they die from influenza, that is flu. So that excludes any other flu type of infections like about RSV laba or about COVID, virus, and strep and all these other things. I'm only talking about influenza. So that's why it is important for us to be prepared for the flu season with the knowledge, with the awareness, with what we have under control, Tina, as people, to prevent spreading whatever that we have and to protect those that are vulnerable. Everyone has a role to play. It's not just the government, it's not just medicine, it's not just your doctors, it is not just the healthcare system or the hospital. Me and you also have a role to play, right? So it's important to be empowered and to know what we should do. Flu season, it means everyone is sick, right? And in this flu season, when we are sick and we are coughing and we have flu-like symptoms, you could be suffering from influenza itself, the one we said ibulala about 11,000 people in South Africa per year. It could be COVID. We all know about COVID. It could be RSV as well. It mainly affects abantwana abancane, like children. And nabaye emakhreshi bayathelelana nekolweni bathelelana babuye bakuthelele nawe ekhaya njalo ircirculate le virus yenu lapha ngendlini nithelelane nonke, you know. So nge-flu season, those are the most common viruses ezikhosa surges. Surges is waves, or everyone getting sick at the same time. So as much as there's all other important viruses and bacteria, during flu season, we are focusing kakhulu COVID, RSV, and influenza, because those three are the ones that are causing surges. Others people get sick from, obviously, but they don't normally causing surges the way these three are causing surges, right? So these three are very important for us to know about them, and know when to test and who to test. Because doctors, they will go around and bully doctors to test them. They're not required or recommended for them to test everybody. It's not general testing for everybody. But there's definitely people that you need to test as a clinician, as a doctor, right? And now meluzas, if you're among those people that needs to be tested. So test all about risk severe disease, because no severe disease be admitted. You may need ventilation or assisted breathing. You may need ICU, you may need so much more. So it's important to know what you're dealing with, right? And now you can't intentionally spread it to others, because other people may even die from what you're giving them. So there's people that needs, I always said it, that needs to be tested. Obviously, pregnant people that are at risk of severe disease, including pregnant women, babies, children under 5, especially those under 1, elderly people more than 65 years of age. Who else? Those at-risk population, right? Those are the people that you need to make sure you're testing. Now, those with comorbidities, very important. Those that have pre-existing medical conditions. Those that are taking chronic treatment, or they have chronic diseases. Those are one or other group that you need to make sure that you are testing and you are protecting them at all costs. So, Ngalea variant is not yet picked up in South Africa. It doesn't mean ayiko or angekivukibekon. It just means for now, it is not among us. But the good thing is that in South Africa, we have these tests. When we're testing for flu-like symptoms, that particular test, A1, is able to give you results, both RSV, influenza as well as COVID. One test is able to give you that. So flu symptoms, they can always be testing, right? And in case COVID, we know that we have genomic surveillance as well that goes on to look into what variants are circulating. Although testing is very much decreased, especially for COVID, it's no longer as active, it's no longer as the way it used to be, because we're out of a pandemic crisis, but it's still very much available. Testing is available. Clinicians are still going to test. If we are go to one of the vulnerable population that I'm talking about at risk of severe disease, you know you have a right to be tested, or I can't even say the right. Clinicians attitude in. You know, we are a happy family here. So you know that you are one of the people that it is recommended. Yeah, a good word is that it is recommended for you to be tested if you have flu-like symptoms, if you're among those people. Those comorbidities, those that are pregnant, even postpartum, 2 weeks after you're still under risky population, the babies, the elders, you know, pregnant women, we as Labonje, those are the people that it is recommended for them to be tested. It's recommended to be testing it depends of course of what you're testing with. It has to be the test. Now go get my field of expertise these days. A test that has highest accuracy. Test siyahamba siwa quantify noma siwa study how good are they in picking up the disease or in identifying the disease. If you are sick, we need to know exactly what do you have. If you're saying a test yami flu is negative, how much should we trust that negative? How negative is that negative? How positive is that positive? That talks to the quality of a test. So, yeah, molecular diagnostic test, rapid molecular diagnostic test, they are the ones that are recommended. And then you get your results in less than 36 minutes, in less than an hour with the rapid molecular diagnostic. Those are PCRs. It's not antigen tests. Antigen tests, they are associated with false negative. The accuracy is not as good as the rapid NAAT. I'm coming back to explain more what it means on another video.